Welcome back. When it comes to our health, there are so many topics that are considered embarrassing or taboo, but listen, we all go through them and we discuss them all on Cityline. So who better to help us through this than Bryce Wylde? We're gonna get TMI, right? So we've been doing a segment with Bryce called That's TMI, and this time we are tackling fungal infections. So there's so many different types. But they're not all created equal, are they?
And they're not also the healthy mushrooms that we're often talking about, right?
Not.
I'll tell you what, though, I will always be your fungi.
I'll always be your fun gal.
It's pretty straightforward. These are the yeasts, gross, and the the various funguses of the world that can often cause dermatological issues.
Yes.
And so what we're looking for as a theme are typically like the scaly white purus or exudate, often infected in many cases.
Okay.
Funguses and yeasts. And listen, it could be anything ranging from athlete's foot, that gross, stinky athlete's foot that we've all heard about, to crotch itch, right?
Okay.
Through to, the white oozing vaginal yeast infection, which we won't show up on screen. How about that?
That was such a nice description.
Right? So we all have
but
had
honestly,
these.
so many of us have been through it. It's actually normal. I know it's gross, but it's normal, and we all move through it. So many of us have had infections. You will learn a lot from this because we're going to start with tinea.
Tinea.
So we're going to start with?
Absolutely. The most common ones are tinea and candida.
Okay.
Tinea, you'll notice a theme here. We've got some home remedies we'll talk about. The theme with tinea is it does really well with essential oils as a theme.
Okay.
Where yeasts do really well with probiotics.
Yes.
Okay, so we'll get through this. So starting with tinea pedis, which is the feet. If we use some apple cider vinegar in water, 1-to-1 part, and soak our feet, it's a month, but it's 20 minutes a day. This will go away.
Oh, well, that's good.
And after that's done, coconut oil is a carrier with rosemary oil.
Okay.
1-to-1, you put that in your hand, you rub it around the area. Again, it's stubborn, but it can easily go away.
So a little apple cider bath and a little coconut oil lotion.
For the athlete's foot, tinea pedis is gone, right?
Okay.
And by the way, you should always talk to your doctor pharmacist before starting any of this, and even get second opinions if it's not going away, because it can complicate. The tinea corporis, or body-wide ringworm, which is not a worm.
Okay.
Ringworm's a yeast, or rather a fungal infection.
Got it.
Aloe vera, it does very well with aloe vera. Yeah, that's right. It looks like a ring-like structure, and the center is kind of often white.
Okay.
But aloe vera gel, not the water or the drink, but the gel, topically.
Okay.
That crotch itch I was talking about, the jock itch, there are commercially available probiotics for that. That does a little bit better with this probiotic cream.
Okay.
Anyone can get that at a health food store. Right.
Yeah.
When we're talking about capitis, or the head version, dandruff, or in children, cradle cap.
Cradle cap,
you don't want to do this with children, by the way, or babies.
Okay,
And you don't want to get this in your eyes, but a simple natural shampoo, right, non-scented, with none other than lavender oil.
Okay.
So lavender oil does really well, if you don't mind the smell of that, or even cinnamon oil for that matter.
Right.
In the entire bottle, in a bottle of shampoo, and you shake it up. 2 minutes, you lather it in. Don't get it in your eyes. Rinse it out. Amazing results for
cradle cap or for dandruff. Not the cradle cap. Don't use it on the babies.
That nasty fungus that we all get. You've all seen the commercials on TV. The lazy husband sitting on the couch. It's just a nail infection, and the doctor chimes in. No, it's not. It's got to be treated, right?
We all know that ad.
Here's what works really well naturally: garlic orally, because garlic's very antifungal.
Okay.
Along with oregano oil topically. This combination in my clinical practice seems to work incredibly well.
So you're putting that on the actual nail, on the actual toe, and
overnight,
this you're having like your orally.
Twice a day. It's also, by the way, good for the heart.
Beautiful.
Yeah.
Okay, so now I think we're moving into candida, aren't we?
Right, we're moving into candida, and this is a challenge for a lot of folks. Oral thrush, if this is typically if candida is invasive within the mouth, and by the way, it can translate into the bloodstream. It's very white. Candida albicans is the cause. Albicans is Latin for white, so white versa. This is something you need to talk to your doctor about. Typically, often people are immune compromised. If it's a yeast infection, however, things that happen in the mouth are very similar to the things that happen in the vaginal canal. It's easily treatable. If it's a standard everyday yeast infection, typically first-line therapy, over-the-counter stuff works, starting with Greek yogurt, non-flavored. You don't want to put strawberry. You don't want to put strawberry up there, just the plain. There's something that you can one-up on that, and that's called BioK. This is commercially available. Again, the plain, not the flavored. Literally clean your hands under your nails. Make sure you're very hygienic about this. A little dollop, and whoop, up there.
So not even a suppository.
No, just
you can
like
do it
slather
yourself.
it absolutely just before bed.
Yeah.
And you know, it's going to cure this better than the standard over-the-counter antifungal.
Yeah. Well, it better be before bed, not before you go to work.
No, right. So and if you don't,
that's going to be quite the day.
Yeah, you're going to need
Like,
maybe a double pad for that one.
Right? Again. It's a little moist.
Nothing like probiotics to treat yeasts, okay? Even topically, by the way. All right.
Okay.
So now, if you don't want to do that, sounds like a little messy to you, or it's TMI, then what you want to do is the commercially available probiotic suppositories.
Fair.
But before you do that, an incredible natural ingredient called boric acid. This is very antifungal, so anti-yeast, going to kill that stuff. Again, this is actually a really funny. It's called
Up and Away.
Up and Away. There you go. There's so many other boric acids out there, but I thought that was funny. Up and Away, and it goes. So boric acid followed by you know, the standard probiotics meant for that.
Beautiful.
But diet is so important.
Yes, it
right?
is. So let's talk about nutrition.
So when it comes to the gut, there's so many commercially available products that kill the candida in the gut because this causes dysbiosis. So the yeasts come out, and it's all about real estate down there. They take over the environment against the good bacteria that you should have, and they become pathogenic. This can lead to brain fog, upset stomach, diarrhea, you name it. Get rid of the sugar, go for alternative sugars, for example, xylitol, get rid of the alcohol, get rid of the refined carbohydrates, cakes, cookies, breads, pastas. It's got to be strict,
everything good in life.
Right, but do this strictly.
Get rid of it.
And the reason we know this is actually quite prevalent is through stool analysis. We see this at about 1 in 50 patients actually have full-blown candida in the gut, beyond just the dysbiosis or imbalanced bacteria. And this can cause a plethora of symptoms. So, you know, maybe first get tested, and then you can look on the market. There's so many anti-candida. Typically, you're going to see caprylic acid in there, undecanoic acid, grapefruit seed extract, oregano oil. These are all very powerful things to kill candida. But the most important is diet. You got to get rid of the sugar.
You got to get rid of the sugar.
Yep.
I love that you give us all the different options because there are people that will use that option. They feel comfortable with it.
This
so
is an
thank you,
amazing
Bryce.
option for the yeast infection.
All right.
Absolutely.
Now you have everything you needed to know. Okay, let's go to break. We got more coming up. Stay with us. It's good information.